Well, the average life expectancy in the United States is 81 years for women and 76 years for men. The life expectancy of a member of the Lakota Sioux tribe living on the Pine Ridge Reservation in South Dakota is 52 years for women and 47 for men. The primary cause is the living conditions on the reservation. Some individuals are living without electricity or running water. Poverty and crowding contribute to a TB rate that is 8 times that of the national average. Other diseases related to poverty and living with the legacy of historical trauma are commonplace. Inequities are killing people prematurely across all communities in the U.S. Every year, as many as 245,000 lives are unnecessarily lost due to low education, 200,000 due to poverty, and 80,000 are lost due to blacks dying at a higher rate than whites. Health inequities are avoidable deaths and diseases. They are perhaps our single most important public health challenge in America. The most influential and most fundamental causes of health inequities are what we call social determinants. Poverty, low education, and low social status, lack of access to safe housing, safe employment, and structural and interpersonal discrimination and lack of social connectedness. We have made small strides in addressing some health inequities, primarily from increasing access to health care. For example, racial disparities in cancer survival have narrowed, with the exception of breast cancer in women and colorectal cancer in men. Drops in mortality due to heart disease, HIV, and homicide have helped narrow the gap. Unfortunately, the gap between blacks and whites has also narrowed because life expectancy among poor whites has been dropping over the past 3 years. So we have yet to tackle the larger social determinants that stem from wealth inequality, which has widened dramatically over the past 3 decades. Since so many inequalities in health stem from social determinants, we in public health need to become partners with other sectors. We need to provide the expertise and advocate to have government, nonprofit, and for-profit organizations set goals and evaluate outcomes depending on if they contribute to reducing health inequities. Some local examples include creating a city plan that sets goals for increasing access to healthy food for high-poverty neighborhoods, or advocating for organizations and city government to set higher goals for purchasing services locally, including among minority-owned businesses. We can promote our excellent STEM careers among children growing up in poverty.